staggering toll at the nation's nursing homes and assisted living facilities.
The outbreak is taking a toll on nursing homes.
The governor now issuing a series of mandates tonight, including limiting visitors to nursing homes.
Your symptoms of coronavirus tend to be more severe in the elderly, and right now, local long-term care facilities are in prevention mode.
As COVID really started hitting nursing homes across the Northeast, which most of our facilities are primarily located at, we came to realize how serious this was. Patients really getting sick, and unfortunately soon thereafter, our staff getting sick as well. It was just like a tsunami, all coming in at the same time.
Near the end of February, we started to pull together a task force for the organization to be able to spearhead things, and little did we know that after that first call on March 5th, that it was going to really take over our lives.
We worked tirelessly to try to prepare for what was going to happen. I did not think that the outbreaks that happened were actually going to happen the way that they did.
It very much felt like we were in a military campaign, that we were fighting against this invisible foe that just kept attacking, and we did not have enough knowledge to know what to do, so we were doing everything we could.
It was very emotional for me, still is. Once a week, at one point it was twice a week, to have to tally how many residents we lost, how many residents we were caring for, and knowing that, you know, was somebody's loved one.
It was happening so fast, you couldn't even mourn. I don't know that any of us have yet, because it wouldn't stop. It wasn't the tragedy of one person having an untimely death. It was the tragedy of every time you turned around, someone who you knew had had an untimely death.
When the virus hit, I lost 6 friends in one day. It was just amazing how quickly it hit. It was just a shock. I couldn't believe it.
People rose up and did what was needed, where people who wanted to run stood up and walked forward and took care and saved lives, saved countless lives.
In 29 years of healthcare, we dealt with something that really no one in this generation ever has. We've not had a pandemic impact us like COVID-19. We came out stronger on the other end.
Dina Harmon is a saint. We look to her to guide us, especially in times of stress and challenges, and she didn't waver. She did what she needed to do. She really was on the forefront of keeping us current and helping us provide the best quality care to our patients.
Everybody felt confident looking to Dina, even as she probably was furiously seeking information and guidance herself. She really led with a calmness and kind of resilience that I think made everyone more comfortable when we all weren't feeling so comfortable.
In January, when the outbreak was in other countries, and we thought about what would happen in our country, I really thought we were in a better place than possibly some other countries. And the outcome wasn't what we had thought it was. So the reality was really harsh.
Sharon provided a tremendous leadership during the COVID-19. We didn't know how we were going to get through this. Is there an end in sight? And we would focus day to day, and Sharon was the cheerleader for that in keeping us all focused, reminding us that we are caregivers and we will get through this.
Sharon was in the trenches. She was hands-on, sleeves up. She was in every facility, and you would know where Sharon is that when you know where the pandemic hit hard.
Sharon was always positive in her outlook. Never once did I hear a negative thing come out of her mouth. In regards to COVID, in regards to what we have to go through as a team, it was always, there's a light at the end of the tunnel, we're gonna get through this. This is just a trying time for all of us.
We lost friends. We had 6 employees die, and I remember that when at Oakland, when we lost 2 employees to COVID, and I remember meeting with that staff, and I was standing in this big dining room we have there, huge room, with I don't know if it was 100 people, but at least close to 100 people around me. And one of the aides started reading a prayer, and we all prayed together. We all prayed the psalm together. And so that, for me, are the moments that I'll never forget from this.
Mike was one of those people who took a step forward and did anything and everything to protect his residents. He literally went into the lion's den of COVID to ensure that his residents were well taken care of and safe and protected from this.
What's interesting about Michael is that he too felt the urge to be at a center every day and to really be working side by side with staff and working with residents and their families especially to make sure that it was well known that even though family members could not come into the center, that we were still able to care for their loved ones.
Mike invests all that he has into leading this operation. And there isn't a person in this organization that wouldn't say Mike Smith would be there in a heartbeat if there was anything he could do to support the operations of his facilities.
This is exactly the crew that you want at your side going through a crisis. Mike, Sharon, Dina, folks who not only are seasoned clinical folks, seasoned operator folks, but folks who literally gave it 24/7, gave it all they got to lead by example. Unbeknownst to them, tonight we are honoring Mike, Sharon, and Dina with the Exemplary Leadership of the Year Award. The three of them have the true character of what Marquis is. Gut, spirit, and mind. That's who we are. It makes us who we are as an organization. And through their leadership, they show what Marquis is in this industry.
On behalf of the entire company, I'd like to take this opportunity to thank Mike Smith, along with Dina Harmon and Sharon Donahue, on their leadership and dedication throughout the COVID crisis, ensuring that our residents were well taken care of and received the most protection that any resident could receive in a nursing facility.
From the bottom of my heart, I want to thank Mike, Sharon, and Dina. Thank you doesn't go far enough. However, this award is a very small token of appreciation for everything they've done throughout this COVID crisis and everything they continue to do for our organization as a whole. May God bless you with many, many years of health and happiness. Thank you again.
Please welcome Michael Smith, Sharon Donahue, and Dina Harmon, Exemplary Leadership Award.